Hi, I'm Earthea Nance. I'm an associate professor of urban planning and environmental policy at Texas Southern University.
As you predicted, all the engineers insisted that participation was the key to success for condominial sewers. So I'd like to talk to you about what the other factors that you found that contributed to success.
I found that there were a variety of factors that contributed to success. Participation may or may not have been one of those factors. What was really important was that the agency in charge of the project was a competent agency, that it implemented the project fully, that it provided good maintenance and good service to the community. Also that public officials who are in charge, whether they be mayors, governors, or whoever else was in charge of elected officials, had to be in support of the project, to believe in condominial sewers, and to support the agencies that were in charge of implementation. The residents themselves being well organized so that they could communicate and in some cases influence the agency and public officials to give them good service. That was also an important element. In terms of participation, participation in mobilizing around the project and in decision making for the project were found to be important for outcome. Participation in construction and maintenance, however, didn't seem to have much influence on the outcome of the project.
So most projects use connection rate as an indicator. What do you think of that indicator, and what are some better indicators that you?
I've seen many projects where the community was connected, you had a high connection rate, but there were still open sewage ditches running through the neighborhood. People still had health problems. There was still a stench in the neighborhood. The neighborhood was not cleaned up, it wasn't dry, even though they had a condominial sewer and people were connected. So the connection rate alone is not a good measure of performance. The operability of the system, whether it's damaged, whether it's leaking, how well it's actually transporting sewage, that's an element of performance, as well as whether people are satisfied, whether they report a lot of problems, whether they report advantages after having the system or not, and also whether more people are connected. All of those things together reflect the performance of the system.
Is there anything else that you'd like to add about that's important for us to know about condominial sewage?
I'm not sure if you want me to talk about the discourse aspect of my research.
Yeah, sure.
And the role of the participation narrative.
Yeah, I think that.
Yeah,
sure.
Because that's a little bit controversial, because that narrative was essential in getting the innovation off the ground. It helped to bring people together around a narrative that had a humanitarian focus. It allowed the original practitioners to attract resources from the World Bank and from other sources to the projects, and it was important to inspire people who were going through the democratization process, you know, to kind of lift the country up, and this was part of that. So that narrative was very important. When looked at from an empirical standpoint, and you know, as a researcher, I cannot see a linear causation between participation and performance. What I see is different types of project coalitions leading to good performance, meaning who's elected, who's the agency, the residents being involved, all of those in combination, people working together as a coalition of actors, leads to good performance. Participation is, it can be one of those elements, but is not alone the only element. And so the narrative had a role in bringing about the innovation. In terms of research and theory, the actual understanding of what brings about performance is a little different.
Mm-hmm.
From the interview that I've done with the originators, the project started in Natal, in the communities of Rocas and Santos Reis, and Jose Carlos Mella was the consultant on the project. The project was funded, I believe, by the World Bank, and originally the amount of money that was allowed for the project would have only served a small fraction of the communities had they installed a conventional system. The simplified system that was designed under the leadership of Carlos Mello was our condominial system, and that's what what we're talking about today. The simplified system was established at that point in Natal. The idea of people participating was part of that original project, and even though today that participation is not always used, but that was an important part of the original project. Projects were the projects were expanded in the interior cities of Rio Grande do Norte, eventually moving to Natal, and then as Carlos Mello's from Recife, he brought the idea down to Recife, and so Recife became the second city to expand that. Once the project moved into the capital cities, it became controversial because it violated the engineering laws, the sewer standards, and the design criteria that had been established for sewers. And that is the criteria that was basically used for conventional sewers that are used in the United States and elsewhere. The most expensive way of providing sewage is conventional sewers. So there was a conflict and a great controversy and a great debate about whether it was legal to install condominial sewers. So many of the systems were done on a pilot basis, as an experiment, for example. They often were not accepted by the state water and sanitation company, and so maintenance wasn't usually done. Sometimes it was done, sometimes it wasn't. And this went on for a long time, where it was controversial. There was a cadre of supporters, mostly engineers, but some of them were architects and from other fields as well, who supported and promoted this technology using the participation paradigm. And they actually, that group is responsible for bringing this innovation about. Over time, the people in Brazil have started to believe in the technology, over many years. I'd say, after 20 or 30 years, it's now becoming popular. It's now becoming accepted. Some of the key things that had to be done to bring people about were to change laws and to change rules. So getting the design requirements to be changed, in different cities, that was one of the most important things, and that was done in the city of Recife by the mayor there. It was also necessary to have counts of the number of connections, so that was part of the data that was being taken. Eventually being counted in the census as a formal method of sanitation, so that's now included. These are things that formalized that technology and made it possible to reduce the controversy, reduce the chaos, and now really it has a lot of momentum. The technology is moving from one state to another, it's moving in other countries, and it has a momentum now. It's no longer controversial.